What is the hygiene hypothesis in Ms.? Have you ever wondered how our environment might influence the risk of developing multiple sclerosis? The hygiene hypothesis offers an intriguing perspective. This theory suggests that low exposure to certain infections and microorganisms during early life may increase the risk of developing multiple sclerosis, which is an immune-mediated disease. This idea comes from observations that higher hygiene standards in childhood and reduced exposure to common infections are linked to a greater prevalence of multiple sclerosis, particularly in industrialized nations. The hygiene hypothesis posits that early encounters with a variety of microbes, including certain bacteria, viruses, and parasites, help train the immune system. This training is crucial for developing proper tolerance and regulation. Without these early exposures, the immune system might malfunction and mistakenly attack the body's own tissues, which is what happens in multiple sclerosis. Research has shown that the risk of multiple sclerosis is higher in childhood environments characterized by high sanitation and fewer infections. A notable example is the Epstein-Barr virus, which is linked to multiple sclerosis, especially when it causes symptomatic infectious mononucleosis in adolescence or adulthood. This connection supports the idea that a lack of early exposure to Epstein-Barr virus, which is common in childhood, may increase the risk of developing multiple sclerosis later on. Interestingly, some infections seem to have a protective effect. For instance, infections with Helicobacter pylori bacteria and Helminth infections, which are parasitic worms, have been associated with a lower risk or milder course of multiple sclerosis. This aligns with the global pattern showing that multiple sclerosis is more common in developed countries with better sanitation and lower infectious disease burdens. Epidemiological studies, animal models, and some clinical trials have provided support for the hygiene hypothesis, exploring how microbial exposures can modulate the immune system. However, it is essential to note that common childhood infections and vaccinations do not appear to significantly influence the risk of multiple sclerosis, indicating that not all microbial exposures are relevant. The hygiene hypothesis does not promote poor hygiene or increased infections. Instead, it highlights the complex role of specific microbial exposures in the development of the immune system. In summary, the hygiene hypothesis in multiple sclerosis suggests that reduced early life exposure to certain microbes may impair immune system regulation, increasing susceptibility to multiple sclerosis. This concept is part of ongoing research into how environmental factors interact with genetics to influence the risk and progression of multiple sclerosis. It emphasizes the importance of balanced immune system training rather than general hygiene practices and does not contradict the need for standard medical care or vaccinations. Always consult healthcare professionals for personalized medical advice regarding multiple sclerosis and related concerns.